Welcome to The Point. And we have a really exciting program for you this evening. And we have the wonderful Dr. Laura, our practicing GP, who's talking about coping with a menopause.
Indeed.
Laura, welcome to the program.
It's quite an interesting program, particularly for you wonderful women out there, but also those who are married to the women going through the menopause and those who live with these women and work with these women. It's going to be really, really interesting. I know the menopause can be a very, very difficult subject for some people, so we're not making light of it, but it is important to highlight the symptoms, but also how to help you through it, and that's what we're going to be doing today.
Well, that's absolutely wonderful. We've got, as I say, our practicing GP, who's much more informed than I am, because I used to be a GP, but that was an awful long time ago. And Laura, I think you're going to introduce now a little clip you've chosen for us.
Well, this is a fun fact, actually, on the menopause, but it's a different kind of fun fact. It's not the usual Dr. Richard Kent fun facts. Nevertheless, it is a fun fact, and I think you'll be very, very interested in watching this.
Hey guys, it's me. Welcome back to my channel and welcome to my front porch. I find that the lighting outside is better than inside certain times of the day. Okay, so what I am going to talk about today is something that a lot of people are going to be uncomfortable in hearing, so you might want to exit out of this video if you're not interested in the facts about menopause. How fun a topic is that? Okay, I guess I started having menopause symptoms when I was about 48 or 49, something like that, which was kind of young for me. My family history anyway, my mom was a little bit older, my grandmother was older, and so I have actually found some fun facts on my phone. And if you can see that, fun facts. And a man had to write this, absolutely. Fun facts about menopause. And nothing fun about it. It's nothing fun about a bug's trying to get me. Nothing fun about menopause. Okay, so the first thing it says, let's see, you no longer need birth control. Well, yay. Yay, you no longer have to take a pill a day. And that is absolutely worth all the symptoms that come along with it, menopause. Okay, so basically you no longer need to take menopause. You no longer need to take birth control once menopause is complete. So that's a fun fact. Okay, not all women get hot flashes. That's a fun fact for a man. I did get hot flashes. I felt like my body was burning from the inside out. It would happen any time of the day, plenty of times during the night. Apparently, according to this gentleman, all you have to do is, when you're having hot flash, is stick your head in the freezer. Well, if you're riding down the road and in a car or out in public, in a mall or in a store, you don't have a freezer unless it's the Sears where you can just, they have a running fever where they have a running freezer where you can just stick your head in there. That doesn't help. That's stupid. That's stupid. Okay, anyway, they're miserable. They really are. I had gotten me a little handheld fan that you just turn on and you just fan yourself. That didn't do any good either. But, okay, moving along. Okay, the next fun fact about menopause, you get weight gain around your midsection. And that's typical. No. What really happens is when you are going through menopause, you want to eat every chocolate donut in sight. That's how come you get weight gain around your midsection. You just have cravings for chocolate, fattening stuff, just mainly chocolate donuts for me. Okay, hormone therapy, good news. Hormone therapy, a treatment option only for hot flashes, severe hot flashes. I did have severe hot flashes. I am on hormone therapy. There's a chance it could cause cancer a serious chance. It could cause cancer, cause stroke, heart disease. So you really have to keep up with, going to your doctor and getting checked out often. But is that a fun fact? Okay, number 7, sleep difficulties, anxiety among common complaints. Well, there's a fun fact for you. One, that a person that already has anxiety, your anxiety is higher when you're going through menopause. You can't sleep. Depression, forgetfulness. I can't remember my name half the time. I mean, seriously, I'll repeat things 100 times in case you haven't noticed that. I can't complete a full sentence almost. It's just terrible. I mean, that's not a fun fact. How is that fun? This man must not have ever lived with a woman who was going through menopause. Okay. There are alternatives for hormone replacement. You can take black cohosh. Doesn't help. Didn't help me. Might help you. Adding soy food to your diet. Using primrose oil. Am I saying that right? Primrose oil, or combining some of these treatments all together. I did try peppermint oil when I had all the hot flashes. It didn't work. The one I really love is sticking your head in the freezer. This guy. Okay, osteoporosis risk increase after menopause. Yes, it does. I had a bone density test, and I had a male gynecologist, and which I'm not saying he was, he's not good. He was, whatever. But after I had my bone density test, all he said to me was, don't fall out of the bed, you'll break a hip. Thank you. I paid you for that. I appreciate you. All right, heart disease risk increase after menopause. There's a fun fact. Heart disease risk increase after menopause due to the decrease of estrogen levels. Okay, so do they tell you to take more estrogen? Not generally. My doctor didn't. He did not tell me to do anything specifically besides pray for your husband. Okay, your voice may change. This is the last fun fact. Your voice may change. You're going to get a deeper voice like a man. That's a fun fact. A small subset of women can experience a voice change after menopause, though most do not. Facial hair can increase. So you're talking like a man. You're having to shave your face now, amongst other things, and you're having to walk around with a refrigerator or a freezer stuck to your head. I mean, seriously, I read some of the silliest things, and I can't even believe what I just come across on my phone. And so, yeah. I don't even know what to say about that. That is the most ridiculous thing. And I don't believe that a man, and this one is not even a doctor, he's not even a doctor, should be an expert on menopause. I think a woman, if she's going to speak to you and she's not a doctor, should be telling you facts and not fun facts. Nothing fun about this. She should be talking to you about what to do to get actual help, where to go to get help, what stuff you should really be on, the effects it has on your health. Just get your facts straight, gentlemen, man, full of fun facts. I'm not bashing on men, really. I'm not. I mean, my husband has put up with a lot from me through my menopause, and sometimes he's been sympathetic, sometimes not. But I mean, it's just part of life that we have to go through. But to think it's fun, it's not fun. No, it's not. So anyway, that's my rant for the day. And I guess go buy you a small freezer and put over your head. I don't know. The only advice I got for you. No, seriously, go see your doctor. Bye.
Welcome back to The Point, and there we have a patient's view, her own personal fun facts, and as she says, it isn't a lot of fun. So I understand, because I'm not a lady, but curiously, men have menopauses too. Now that is very controversial. I'm not quite sure what Laura thinks about that, but we're going to stick to the ladies. Over to you, Laura.
Yes, I mean, that poor lady certainly described, in a nutshell actually, what the menopause can be like to some very unfortunate women. And good to know that not all women go through all those symptoms, but a good number of them do. And as she said, I happen to be in a position at work where I'm a GP and I'm female and I know about the menopause, and I've seen lots of women who've come in with these symptoms and are really going through hard times. So shout out to you women out there, shout out to your husbands and the children and the workmates who actually help you or don't help you, as the case may be, and hopefully this will be an enlightenment to everybody about what can happen. So briefly, what is the menopause? The menopause is described as a time when the ovaries are no longer releasing eggs on a monthly basis and when periods stop. Now, there's a slide I'm going to show you which shows the hormonal changes when a woman comes to the menopause. This usually happens about the age of 45. If a woman enters the menopause at 45, it wouldn't be considered as premature. Anything below 45 would be considered as premature. And what happens, as you can see in that graph, I mean, this puts the menopause at an average age of about 51, but it can be a lot younger. It tends to be older in women who are sort of Afro-Caribbean Oriental age, and it tends to be a younger age in women who are more Caucasian Western in ethnic origin. So what happens with the menopause? Estrogen levels, as you can see, drop quite dramatically, and so do the progesterone levels. And of course, estrogen and progesterone are produced in the ovaries, and these ovaries have been there since a girl was actually in her mother's womb, and then they mature at puberty, and every month they release an egg, and that's how you get the menstrual cycle. And in the menopause, what happens is that those two hormone levels drop, but then instead you have a rise in FSH and LH. Now, those two hormones, FSH and LH, are very, very important. And I'll tell you why in a minute. Now, the next slide shows actually what the purpose of estrogen is in the human body. And this is why the menopause can be traumatic for some women, because the loss of estrogen means that these target organs no longer function with the environment of a high estrogen level that they once did. So in the woman's heart, it prevents cholesterol buildup, and that's why women, when they get the menopause, are more at risk of developing high cholesterol and heart disease-related problems issued with that. It affects the liver, where the liver helps to reduce cholesterol, and again, that has a knock-on effect on how much cholesterol is circulating in the body. Estrogen helps promote the ovaries to release eggs every month, so the woman ovulates, and that's how she can become pregnant. And if she doesn't become pregnant, she has a period. It affects the uterus. The uterus lining builds up in preparation for pregnancy, and then when pregnancy doesn't happen, the lining of the womb is shed in what is called a period. It keeps the female internal organs, the female organs specifically, moist, well lubricated for the purposes in which God created them for. It affects the brain, it helps with body temperature, it helps with mood, it helps with memory, it causes the breasts to remain in the normal functioning, both for the normal menstrual cycle but also for breastfeeding. Skin is affected, collagen supplies are affected, oil glands are affected, and it keeps the bones nice and strong. So that's a summary of what estrogen does. And you can imagine when there's a dip, as you saw in that graph of estrogen, all these particular functions are affected. So the woman who rightfully described the mood swings, the low libido, the dryness of the female genital organs, problems with memory, sleeping, hot flushes, and all those sorts of things come into play. And the next slide just basically shows the sort of symptoms that a poor woman would get due to the menopause. And really they are related to the weight gain due to metabolism, fat metabolism, sugar metabolism, takes a nosedive, women tend to gain weight, and sleeplessness, probably due to hot flushes, as well as problems with low mood, mood swings, depression, all those sorts of things, irritability. And as a lot of you women find, this is a time in your marriage for some women where your children are leaving home, and you're feeling the effects of children going off to college, university, and then you're having all these symptoms, and you've probably got elderly parents who are needing more help from you at that stage, and your husband's thinking, well, what the hell's going on here, woman? And so I really sympathise with you, and as I said, a lot of women do come into the surgery to discuss these problems. And the way to deal with the menopause, there isn't one single way. As you can see, it affects different people in different ways, and it affects lots of different organs and functions in the body. So what do I tell patients who come in with the menopause? Done a lot of research, I've done a nutrition course as well, and therefore I've had lots of insight, plus feedback from patients about what works as to how you can treat the menopause. Very important in treating the menopause, which is a natural, it's a natural state, like pregnancy is a natural state. The menopause, entering the menopause is a natural state, and it's about helping you through this state, holding your hand through it and helping you through. So that's what I'd like to just focus on today. So what can we do? Diet is so important. It's important about the things that you take as well as the things that you don't take. On the blacklist for women who have menopause are stimulants like caffeine, so alcohol, caffeine, high sugar refined foods, junk foods, processed foods, foods with high refined carbohydrates need to come off your list on a regular basis. And the reason for that is because of the swings in your blood sugar. One of the problems with the menopause is that your sugar metabolism does change. Women who enter the menopause are more prone to developing type 2 diabetes, and therefore it's very important that you really start to observe a healthy diet. So like that image showed you, you need your healthy oils. You need more of your nuts. You need especially things like linseed. Linseed's very high in omega-3. It's also high in something called lignans, which help with your cholesterol, but it's also high in phytoestrogens, which provide natural plant-based estrogens to boost your estrogen levels. Other nice oily substances there are the nuts and the other seeds. You've got the salmon, you've got the avocado, and these are all healthy fats that you need to start to incorporate into your diet. So healthy oils like linseeds, sesame seeds, and healthy nuts, cashew nuts, almonds, particularly walnuts as well, avocados, and if you're a meat eater, there's of course oily fish like salmon. Very, very important to incorporate into your diet. As well as those oily fish, you need some really good protein in your diet because, again, a lot of plant proteins contain natural phytoestrogens that will help to boost your levels slightly. So things that you can incorporate into your diet that really do help are things like the beans, the legumes, lentils. Particularly high on the list are mung beans and chickpeas. I mean, these really do work. I have female patients who come back, a month, 2 months later, and say, wow, thank you, because having mung beans and having chickpeas, and you can make chickpeas into hummus, you can make your own homemade hummus, you can pop in some sesame seeds and some chickpeas, boiled chickpeas, adding some healthy oils like olive oil or coconut oil, put it in a blender, and you've got your own homemade hummus, and just splash it on anything. You put it on your jacket potatoes, you put it on your whole wheat bread, and you stick it on your salads and just have hummus coming out of your ears. It really does work. Other things you can have are herbs like the sages. Sage is very high in phytoestrogens. Oregano as well, also very high in phytoestrogens. So add some sage, add some oregano to your diet. Very, very important. Other things that you can have are yams. Yams are very high. Lots of people living in areas where there are ethnic shops. You can go in and get your yams, which are like, what are yams like?
You tell me.
They are like potatoes. They're like white potatoes, but they're long and big, aren't they? They're sort of tuberous.
Are they the same as sweet potatoes?
No, they're in the same group of family. They're sort of longish. I'm trying to think of well, I'd say like sweet potatoes, white sweet potatoes, but they're quite long. The yams are very good. They're high in phytoestrogens. Add those to your diet. So add the beans, the mung beans, the chickpeas, the yams to your diet. Other things that are very important are the berries and the cherries. Again, they raise the phytoestrogen levels. I just want to make sure I haven't left anything crucial out. Tofu, but it has to be GMO. Very important. It's a non-GMO tofu. Tofu is made from soybeans, and of course, as we know, a lot of soybeans are genetically modified. Stay clear of those. Make sure you get them in a health food shop or where you can get some organic, non-GMO tofu miso soup, also high in natural phytoestrogens. Herbs I've mentioned the sage and the oregano. Parsley as well is very good. Thyme's very good. Supplements that you can add to your diet, Agnus castus is very good for menopausal symptoms. So are things like red clover and black cohosh, ginseng, maca, very good as well. And these are all things that are really helpful. So by adding all these things into your diet, you raise the natural phytoestrogen levels up and therefore help you from suffering too much the effects of low estrogen. Just to warn you about things to avoid though, things that are called xenoestrogens that are found in things like plastic. We've mentioned before, Richard, about bisphenol A, which is found in certain plastics. Try to avoid products with plastics, and particularly if they don't have a guarantee of being non-BPA, because those release what they call xenoestrogens, which actually compete with your natural estrogens and the phytoestrogens for the estrogen receptors, and they can actually block the intake of these natural phytoestrogens and make your menopausal symptoms worse. So that's it in a nutshell, and there's a lot more I can talk about, but the message is that there is hope and there is help with your menopausal symptoms. Do your research. I've done a lot of research, and as I said, I have lots of patients coming back to say these things help them, so I hope that they have been helpful to you in the process. And Richard, we were going to talk about some biblical menopause ladies, weren't we?
Well, we are. But first of all, thank you, Laura. That's a wonderful presentation, all about how the ladies cope with menopause, and very relevant. And as you correctly say, that's how God designed the ladies to function. And we must remember that menopause is a normal event in the life of a normal lady patient, or a normal lady, let alone lady patient. However, we were going to comment that on some occasions God actually changes things, and there are a couple of examples. There's first of all the example of Abraham and Isaac, and we're told in the book of Genesis that Abraham and Sarah, I should have said Abraham and Sarah, there we are. Now they were elderly, but God had promised an offspring to Abraham and Sarah. Originally they were called Abram and Sarai, but God changed their names to Abraham and Sarah with a H in it, indicating they had a commitment to God, Yahweh. Anyway, even though Abraham and Sarah were very old, there we have little Isaac, born to Sarah at an old age. Now that was a total miracle, because in the normal state, after the menopause, it's not normally possible, or it's impossible normally, for a lady to have a baby. And that's of course repeated in the New Testament. If we see the next picture, we've got there the elderly priests, Elizabeth and Zachariah. And if you remember in the story, Zachariah was in the temple, and Gabriel appeared and said that his wife Sarah would, wife Elizabeth would have a son, and that would be John the Baptist. Very, very interesting story about that, because Zechariah originally doubted what Gabriel, the angel, had said, and said, how can this be? So now we know that from Proverbs that death and life is in the power of the tongue. So it's very interesting, but what actually happened after Zechariah came out of the temple is that God actually sealed his lips completely, so he was completely mute. What God didn't want Zechariah to do is to see his mates and say, well, I know I'm elderly and my wife is very elderly, Elizabeth, she's very elderly too, but guess what, this angel appeared to me and he said that my wife Elizabeth, who's very elderly, can't have a baby, is going to have one, and his name's going to be John. Well, we'll have to wait and see, won't we? Well, that's exactly what God didn't want Zechariah to say, because that would actually put doubt on what the angel had said, and might prejudice the birth of baby John the Baptist, who was arguably the second most important person in the whole of the Bible. Very important, certainly in the New Testament anyway. So that's why Zechariah was mute and couldn't say anything until after John was born, because on a spiritual basis, God didn't want Zechariah to mess everything up by the words of his lips, and that's a message for all of us. But anyway, 2 miracles there, 2 elderly ladies who had babies after the menopause, but that isn't normal, is it, Laura?
Well, it's not, but as Luke 1:37 says, for with God, nothing is impossible. And I think that's so important to know. For some women, God has given them a word, and they're still trusting God, even when they've got the menopausal symptoms. And the word for you today is, for with God, nothing is impossible. And just one more thing actually about the menopause is your bones. Make sure that you are doing bone weight-bearing exercises to prevent osteoporosis. And the best thing to do is either march on the spot or get yourself a mini trampoline and do some rebounding exercises, or go jogging or power walking. That's absolutely right. Do some weight-bearing exercises and use some weights as well, because weights help to strengthen your bones. But absolutely, Richard, with God, nothing is impossible.
Well, that's absolutely wonderful. Well, we have these programs, To The Point, that every Monday evening at 8:30. You're terribly welcome to join us. Now, if you want to actually get in touch with us, you can write to our own email address, which is tothepoint@revelationtv.com. And by the way, Revelation TV, of course, we have the monthly R Times. If you're not receiving your R Times, do get in touch with the office, info@revelationtv.com, and ask them to send you a free monthly R Times to tell you when all the programs are. But also, we have a very active lady, Rochelle, in the office who does lots of social media. And very helpful, if you're on Facebook, to get on Facebook, the Revelation TV Facebook, and also all the other social media as well. We're on virtually all of them. And if you've got any comments, any particular things you would like Dr. Laura, our practicing GP, to comment on or teach us on, do write to the point at Revelation TV. Unfortunately, we're not allowed to respond to individual patients' problems. I'm afraid you have to see your own GP about that, but we will come back to you. Do write to us at to the point at Revelation TV. Now I'm going to let Laura finish us off. We've got another 30 seconds just to finish the program off.
I didn't mention HRT, not because it was an omission, but I believe that that's too wide a topic. The HRT, there are pros and cons to it, and I personally, professionally use it as a last resort when women have been through diet and exercise and that has not succeeded. But HRT is an option that some women feel that they need to take up, and certainly that's something that you need to discuss with your GP. You've been watching To The Point with Richard and I. Thank you so much for joining us, and don't forget to join us on social media as well as info@revelationtv.com and To The Point at revelationtv.com. God bless you.